Thank you, Mr. President. I would like to ask the Minister for Health and Social Care what plans he has to change items available on prescription and if he will make a statement.
On the Minister to reply.
Thank you, Mr. President. The Department has to look at all areas of its expenditure to determine how best to spend its budgetary allocation and secure the best possible health outcomes for the population. This includes reviewing what items are available on prescription. In England, commissioning organisations have chosen to restrict the items which can be prescribed, and we will be reviewing both the savings that have been achieved there and the consequences for patients of these items no longer being available on prescription before deciding whether to follow suit. It is to be expected that the formulary, which is the list of items available to be prescribed, will change from time to time in accordance both with up-to-date practice and cost-effectiveness.
Supplementary, Mr. Hooper.
Thank you, Mr. President. I'd like to thank the Minister for that statement. The Minister is aware of concerns that have been raised around communications and public engagement in respect of the recent withdrawal of gluten-free items from prescription. So I'd like to ask, when he is proposing wider reforms here that he's talking about, will he be consulting on those issues?
Minister.
Thank you, Mr. President. It will be very important that the public has engagement when we decide to come forward with any wide-ranging changes to prescriptions if we decide to follow suit with England. One of the things I'm very keen on, Mr. President, is that we do have a consultation if that comes forward, and I'm happy to give an assurance to the Honourable Member in that regard.
Supplementary, Mr. Hooper.
Thank you, Mr. President. One thing that has been raised as a concern with me by a number of people are concerns around affordability of items being withdrawn from prescription or possible availability, in some cases, of items that are withdrawn off prescription. I wonder if the Minister could please just outline what routes are available to people who have concerns in this area to ensure that they can obtain medicines on prescription that are no longer widely prescribed if their personal circumstances would merit that.
Minister to reply.
Thank you, Mr. President. In relation to, it's not really affordability, but in terms of medical need, which would be assessed. So, for instance, Mr. President, if you had someone who, due to a combination of illnesses, needed something to be prescribed that isn't currently prescribed, there is the ability to request what's termed an individual funding request to the Department of Health and Social Care. There is a procedure to be followed, and there is also criteria. So I just want to spout to the Honourable Court what some of that criteria is, Mr. President. So the patient would have to prove that they're significantly different to the cohort of patients with the condition in question, that the patient is likely to gain significantly more benefit for the intervention than might normally be expected for other patients with the same condition. And when they make the decision, the individual funding review panel is required to restrict itself to considering only the patient's presenting medical condition and what the likely benefits are. So it wouldn't be so much around whether patients could individually fund, it would be around the individual condition they have. And if a combination of conditions meant that they would benefit more than others, they do have the ability via their GP to make an individual funding request.